Welcome to the Medicare Education Center. At Medicare Ph.D., we believe that informed healthcare decisions start with education. That's why we've created this video as a resource for individuals seeking to learn more about Medicare, the national healthcare program for those 65 and older, and those with certain disabilities. Today, we'll talk about the different parts of Medicare, who is eligible, the costs, some pros and cons, when to enroll, and some things to consider as you prepare to sign up for Medicare. What is Medicare? It is a federal health insurance program for people aged 65 or older or those under 65 who are disabled. There are 4 main healthcare options: Original Medicare Parts A and B, and newer Parts C and D. Also, there are Medigap plans that help supplement Medicare Parts A and B. They're also called Medicare Supplement plans. Just a clarification, the terms used to describe Medicare offerings can be confusing. Please try not to confuse the original Medicare terminology Parts A, B, and C with Medigap plans A, B, C, F, G, etc. To be eligible for Medicare, you must be 65 or older or disabled for 2 years. You must qualify for Social Security benefits, whether you elect them or not. Also, you may be eligible based on your spouse's or former spouse's qualifications if you are not eligible. Now let's discuss what is covered under Original Medicare Parts A and B. Part A covers your hospital services, such as inpatient, skilled nursing, home health, and hospice care. Part B covers medical services, such as outpatient care, doctor visits, outpatient medical and surgical services, diagnostic testing, and outpatient therapy.
Some deductibles apply to Parts A and B. Part A has an inpatient deductible of $1,600 for each benefit period. To explain, a benefit period begins the day you enter a hospital or skilled nursing facility and ends when you have been out of the facility for 60 days. If you return to the hospital after 60 days, a new benefit period starts. So you would be responsible for paying 2 deductibles in this case, one for each benefit period, even if you're in the hospital both times for the same health problem. If you are in the hospital for more than 60 days at one time on the 61st day, you will pay $400 per day coinsurance. If you are in the hospital for more than 90 days, from the 91st day, you will pay $800 per day coinsurance. Now, for Part B coverage, which is your doctor's visits and other outpatient services, you will pay an annual deductible of $226, then additional coinsurance, where you will pay 20% of the balance. Medicare will pay 80% of the balance with no limit or maximum. Your premium cost for Medicare Part A is 0 or free if you have met 40 quarters or worked 10 years paying Medicare taxes through payroll. For 2023, the Part B monthly premium is $164.90 per month. It could be higher if you have a high income. Part D, your prescription benefit, typically costs between $40 and $60 per month, depending on your chosen drug plan. Medigap insurance plans typically cost between $130 and $170 per month, depending on your chosen supplement plan. There are additional monthly premium costs for Part B if you earn more than a certain amount based on your modified adjusted gross income. This chart shows the increasing monthly premiums based on your income, whether filing individually or jointly. Here are some pros and cons relating to Original Medicare Parts A and B. Some pros are you have flexibility choice of doctors and hospitals. It is portable. You can take your Medicare coverage anywhere in the country if you choose a doctor or hospital that participates in Medicare. You can also choose your coverage by electing a Medicare supplement or Medigap plan to enhance your coverage through Medicare Parts A and B. Some disadvantages of having only Medicare A and B are: as we said earlier, you have deductibles, particularly a relatively high deductible in Part A and a deductible then 20% coinsurance in Part B. This means you will pay 20% of any healthcare costs after the deductible with no maximum limit unless you choose a Medicare supplement plan at an additional cost. Also, there is no dental or vision coverage in Original Medicare. Now let's talk about Medigap insurance. It's also known as Medicare Supplement Insurance. Medigap plans help to supplement Parts A and B and is offered through private insurance companies. The premiums vary by the insurance company, which coverage is chosen, and the state that you are living in. Generally, Medigap plans do not cover long-term care, vision or dental plans, hearing aids, eyeglasses, or private duty nursing. You can buy a Medigap plan during a 6-month initial enrollment period, beginning the month you turn 65. All standardized Medigap policies are guaranteed renewable even if you have health conditions. There are 10 plan options identified by letters of the alphabet. I call it the alphabet soup. These plans, standardized by the federal government, must offer the same coverage by plan throughout the country, except for a couple of states. Cost is usually the only difference between policies with the same letter. An example would be, if you compare a Plan G in Maryland with Plan G in North Carolina, the coverages must be the same and offer the same benefits. However, the premiums could differ depending on your chosen insurance company. Medigap plans enhance Medicare Parts A and B by covering costs like deductibles, coinsurance, or copays, depending on the Medigap plan chosen. Now let's talk about Medicare Part D, which is your prescription drug coverage. Part D plans are provided through private insurance companies that help cover your prescription drug costs. It is voluntary enrollment, but you must be enrolled in Parts A and B to be eligible for Part D coverage. You will want to enroll during the initial or open enrollment period to avoid possible penalties. Under Part D coverage, as in Part B coverage, if your income is above a specific limit, you pay an income-related adjustment amount in addition to the premium for the private insurance policy you choose. Here is a chart showing the amount you would pay for your Part D premium in 2023 if your adjusted gross income is higher than $97,000 per year as an individual or more than $194,000 if filing jointly. There are additional costs when you reach the famous donut hole we've all heard about. The good news is the donut hole has been shrinking each year, and out-of-pocket costs are getting lower. The donut hole begins when you and your plan combine to spend $4,660 on drugs during the calendar year of 2023. At this point, you enter the donut hole coverage gap. In 2023, you'll pay no more than 25% of the price for brand name and generic drugs while in the donut hole until you reach $7,400 in out-of-pocket costs. You then enter the catastrophic coverage phase, where you only pay a small coinsurance or copayment for your covered prescription drugs for the remainder of the year. Medicare Part C is also known as Medicare Advantage. Medicare Part C plans began in 1997 when the federal government began subsidizing private insurance carriers to offer their plans to replace the original Medicare. The government uses your Part B premiums to subsidize the private insurance companies for replacing the coverages offered by Medicare A and B using Part B premiums as a subsidy. Medicare Advantage plans are provided through private insurance companies, and you get all the coverages provided in Parts A and B. You also may receive other benefits, such as prescriptions, dental, vision, and hearing aids, depending on the plan chosen. Costs vary per plan depending on the insurance company chosen. Some plans offer a 0 monthly premium because they use your Part B premium as payment. Medicare Advantage plans are typically HMOs or PPOs with provider networks. Costs vary depending on the plan chosen. Here are some of the pros and cons relating to Advantage plans. Some of the pros are: all healthcare coverage is in one package, so there is no separate Part A and Part B coverage. Prescriptions, dental, and vision can be included, and out-of-pocket maximums can also be included. Some disadvantages of Medicare Part C are: lack of flexibility. If a doctor or hospital is out of network, there may be additional out-of-pocket costs or no coverage offered. You are limited to PPO or HMO network providers to get the most out of your plan. Possible limited coverage area. Many regional Advantage plans limit coverage to certain geographic areas. Now let's talk about Medicare enrollment. If you currently receive Social Security benefits, you will automatically be enrolled at age 65. If not, there is a 7-month enrollment window: 3 months before your 65th birthday, 3 months after your 65th birthday, and your birthday month, equaling 7 months. If you miss the enrollment deadline, you must wait until the general enrollment period, which is January 1st through March 31st of each year. There is a special enrollment period for folks in an employer group plan who want to continue working until a later age. If an employer group plan covers you, you can sign up for Part A or B at any time after turning 65, or you can sign up during an 8-month window after your employment ends or group coverage is lost. Keep in mind, if you choose COBRA or a retiree plan from your employer, those plans will not count as qualified coverage if you choose to change to a Medicare plan. For Medigap insurance, after signing up for Medicare Part A and Part B when you turn 65, a one-time, 6-month initial enrollment period will begin the first month you're 65 and enrolled in Part B. This period provides a guaranteed right to buy a Medigap policy regardless of your health status. Once the window is closed, you can change plans only by qualifying through health underwriting. Part D prescription drug enrollment is during the initial enrollment period, as in Medicare A and B. Unlike Medigap insurance, you can change plans during open enrollment from October 15th to December 7th without answering medical questions. If you don't sign up for Part D during your initial enrollment period, you will likely pay a late enrollment penalty unless you have other creditable coverage through your employer. Generally, you'll pay the penalty as long as you have Medicare prescription coverage. The penalty equals 1% of the national base premium times the number of months you go without coverage. As we've said, open enrollment is a period between October 15th and December 7th each year that allows you to change plans without medical underwriting. During open enrollment, you can change from Original Medicare to Medicare Advantage, Medicare Advantage to Original Medicare, from one Medicare Advantage plan to another, or from a Part D plan to another Part D plan. Please note, this doesn't include a change from a Medigap plan to a Medicare Advantage plan or vice versa. If you want to change from one Medigap plan to another, you can do this any time during the year. However, you will be subject to medical underwriting. Let's summarize enrollment. Initial enrollment into Medicare Part A and B. You can enroll 3 months before or 3 months after your 65th birthday, including the month of your birthday, which will help you avoid penalties for late enrollment. If an employer plan covers you, there is a special enrollment period after you retire or lose your employer plan. You are allowed to enroll within 8 months of your termination date. This is available for folks still working and covered under a group plan beyond the age of 65. Open enrollment is from October 15th to December 7th, which allows you to shop for better plans, lower costs, or get more coverage. Here are some things to consider as you go through the process of enrolling in Medicare. Evaluate your healthcare needs and what plans cover those needs within your budget. Do you have any other coverage? What are the premiums, deductibles, and co-pays, and how do they compare with each other? Do you want a choice of doctors or hospitals, or are you okay with being in a network? Do you need prescription drug coverage, and what type of coverage do you need? Are you traveling during the year and need a choice of doctors across the country? These are all things to consider as you plan for your health insurance needs in the future. We also understand that navigating the healthcare system can be overwhelming. That's why we offer resources to help you make informed decisions about your coverage, including a Medicare Plan Finder tool. We charge a flat fee of $150 for the use of our tool, which will help you optimize your healthcare options. Call or email us today.